Sexual sadism disorder represents one of the most serious and concerning paraphilic conditions, characterized by recurrent and intense sexual arousal from the psychological or physical suffering of others. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this disorder involves persistent fantasies, urges, or behaviors related to inflicting suffering on others that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Or the individual has acted on these urges with non-consenting persons over a period of at least 6 months. This condition raises significant clinical, legal, and public safety concerns due to its potential for causing serious harm to victims. The clinical understanding of sexual sadism disorder has evolved considerably throughout psychiatric literature, moving from early theoretical conceptualizations to more sophisticated contemporary frameworks. Early psychoanalytic theories interpreted sadistic behavior as manifestations of repressed aggression, power struggles, or developmental fixations at particular psychosexual stages. These historical perspectives often focused on unconscious motivations and childhood experiences as primary causal factors. Contemporary psychiatric approaches have embraced comprehensive biopsychosocial models that recognize the complex interplay between neurobiological predispositions, psychological vulnerabilities, developmental trauma, personality factors, and environmental influences that contribute to the emergence and maintenance of sexual sadism disorder. Individuals with sexual sadism disorder experience sexual excitement from inflicting psychological or physical suffering on others, whether consenting or non-consenting victims. The behaviors may range from psychological humiliation and dominance to severe physical violence, torture, or other forms of cruelty. The arousal pattern typically involves a progressive escalation in the severity or elaborateness of sadistic activities to achieve the same level of sexual satisfaction, creating significant risk for increasingly dangerous behaviors. The condition distinguishes itself from consensual BDSM practices by the presence of either significant distress or impairment, or the involvement of non-consenting victims. The developmental trajectory of sexual sadism disorder often begins during adolescence or early adulthood, though some individuals report sadistic fantasies emerging during childhood. Research indicates a significant gender disparity, with males representing the vast majority of diagnosed cases, though female cases do exist and may manifest differently. The condition frequently follows a chronic, progressive course with potential for escalation in severity and frequency of sadistic behaviors. Many individuals with this disorder report that their sadistic urges feel compulsive and increasingly difficult to control, distinguishing pathological sadism from consensual power exchange relationships. Neurobiological research has begun exploring potential brain mechanisms underlying sexual sadism disorder, though the field remains complex and evolving. Studies suggest possible alterations in neurotransmitter systems, particularly those involving serotonin, dopamine, and testosterone pathways, which are crucial for aggression regulation, impulse control, and sexual behavior. The relationship between aggression and sexual arousal in sadistic individuals involves intricate neurochemical processes that may include dysregulation of empathy circuits and reward systems. Neuroimaging studies have identified differences in brain regions associated with empathy, impulse control, and aggression regulation, including the prefrontal cortex, amygdala, and temporal lobes, though establishing definitive causal relationships requires additional longitudinal research. The psychological profile of individuals with sexual sadism disorder reveals several consistent patterns that inform clinical understanding and risk assessment. Many exhibit comorbid personality disorders, particularly antisocial personality disorder, narcissistic personality disorder, or psychopathy. Research suggests strong associations between childhood trauma, particularly physical and sexual abuse, and the development of sadistic sexual preferences. Some individuals demonstrate significant empathy deficits, emotional dysregulation, and difficulties forming healthy interpersonal relationships. The psychological function of sadistic behavior may include power assertion, emotional regulation, revenge fantasies, or attempts to gain control over feelings of helplessness or victimization. Clinical assessment of sexual sadism disorder requires highly specialized training and comprehensive evaluation by mental health professionals with expertise in paraphilic disorders, forensic psychology, and risk assessment. The diagnostic process involves detailed interviews exploring sexual history, fantasy patterns, behavioral progression, victim selection criteria, and functional impairment. Clinicians must carefully distinguish between sexual sadism disorder and consensual BDSM practices, which involve informed consent, safety protocols, and mutual respect. Assessment tools may include structured interviews, psychological testing, psychophysiological measures, and comprehensive risk evaluation instruments designed to assess violence potential. The assessment process faces unique challenges due to the secretive nature of sadistic behaviors and potential legal implications of disclosure. Many individuals are reluctant to reveal the full extent of their sadistic fantasies or behaviors due to shame, fear of legal consequences, or awareness of the serious nature of their condition. Some may only come to clinical attention following arrest, victim complaints, or court mandates. This reluctance to provide complete information creates significant challenges for accurate diagnosis, risk assessment, and treatment planning. Building therapeutic rapport while maintaining appropriate boundaries and safety considerations becomes crucial for effective evaluation. Evidence-based treatment approaches for sexual sadism disorder emphasize comprehensive, long-term interventions that address both the sadistic behaviors and underlying psychological factors while prioritizing victim safety and risk reduction. Cognitive behavioral therapy serves as a primary treatment modality, incorporating multiple therapeutic components specifically adapted for sadistic individuals. Cognitive restructuring addresses distorted thought patterns, beliefs that justify harm to others, and cognitive distortions that minimize victim impact. Behavioral interventions focus on impulse control, arousal reconditioning, and development of alternative coping strategies that do not involve harming others. Dialectical behavior therapy has shown particular effectiveness in treating sexual sadism disorder, especially for individuals with significant emotional dysregulation or personality disorder features. This approach emphasizes distress tolerance skills, emotion regulation techniques, interpersonal effectiveness, and mindfulness practices. The therapy helps individuals develop capacity to manage intense emotions and urges without resorting to harmful behaviors. Skills training focuses on building empathy, recognizing victim impact, and developing healthy ways of experiencing power and control in relationships. Acceptance and commitment therapy offers valuable approaches by helping individuals accept their urges while committing to behaviors that respect others' rights and well-being. This therapy emphasizes values clarification, psychological flexibility, and mindfulness techniques. Individuals learn to observe their sadistic urges without acting on them and develop meaningful life goals that provide fulfillment through pro-social activities. The approach particularly addresses the shame and isolation often associated with sexual sadism disorder while maintaining focus on victim protection. Specialized relapse prevention programs represent crucial components of treatment for sexual sadism disorder. These interventions help individuals identify high-risk situations, develop comprehensive safety plans, and implement effective coping strategies to prevent harmful behaviors. Relapse prevention typically includes detailed analysis of offense patterns, trigger identification, victim empathy development, and construction of external monitoring systems. The approach recognizes that managing sexual sadism disorder requires lifelong commitment to treatment and safety planning. Group therapy can provide valuable therapeutic benefits when carefully structured and facilitated by experts in treating sadistic disorders. Groups allow participants to address shame and isolation, develop empathy through exposure to victim perspectives, and learn from others who have successfully managed similar urges. However, group therapy for individuals with sexual sadism disorder requires exceptional expertise to prevent inadvertent reinforcement of harmful attitudes or behaviors. Groups must maintain strict focus on victim protection and pro-social behavior development. Pharmacological interventions may be considered as adjunctive treatments for individuals with severe symptoms, high levels of sexual preoccupation, or significant comorbid conditions. Selective serotonin reuptake inhibitors can help reduce obsessive thoughts, compulsive behaviors, and overall sexual preoccupation while addressing comorbid depression and anxiety. Anti-androgen medications that reduce testosterone levels may be prescribed to decrease overall sexual drive and aggressive impulses, though these require careful medical monitoring due to significant potential side effects. Mood stabilizers may be appropriate when bipolar disorder or severe mood instability is present. The relationship between sexual sadism disorder and violence risk represents the most critical clinical concern in assessment and treatment. Research indicates that individuals with sexual sadism disorder, particularly when combined with psychopathy or antisocial personality disorder, demonstrate elevated risk for serious violent offenses including sexual assault, torture, and homicide. Risk assessment must be ongoing and comprehensive, incorporating multiple sources of information and validated risk assessment instruments. Treatment planning must prioritize public safety while providing appropriate clinical intervention. Legal and forensic considerations surrounding sexual sadism disorder are extensive and complex. The condition frequently comes to clinical attention through the criminal justice system following violent offenses. Individuals may face serious criminal charges, lengthy incarceration, civil commitment proceedings, and lifetime registration and monitoring requirements. The legal system's response varies considerably across jurisdictions, with some emphasizing punishment and containment while others focus on treatment and rehabilitation within secure settings. Forensic mental health professionals play crucial roles in competency evaluations, risk assessments, and treatment recommendations. Cultural and social factors significantly influence the manifestation, recognition, and treatment of sexual sadism disorder. Different cultures have varying tolerance levels for aggressive behavior, different concepts of masculinity and power, and diverse approaches to sexuality and violence. These cultural factors can affect both the development of sadistic behaviors and societal responses to them. Treatment programs must demonstrate cultural competence while maintaining unwavering focus on victim protection and harm reduction. Prevention efforts for sexual sadism disorder focus on early identification of risk factors and providing appropriate interventions before serious harm occurs. Programs addressing childhood trauma, teaching healthy relationship skills, and promoting empathy development may help prevent the development of sadistic sexual preferences. Mental health professionals emphasize the importance of addressing conduct disorder, childhood aggression, and early signs of empathy deficits that may contribute to later development of sexual sadism disorder. Contemporary research into sexual sadism disorder continues exploring neurobiological mechanisms, psychological factors, and treatment effectiveness. Studies investigating the relationship between childhood trauma, neurodevelopment, and sadistic behavior provide insights into developmental pathways. Research on treatment outcomes, recidivism rates, and factors associated with successful management informs clinical practice and policy development. Neuroimaging studies examining brain differences and treatment-related changes offer potential for more targeted interventions. The impact of sexual sadism disorder extends far beyond affected individuals to include victims, families, communities, and society. Victims of sadistic offenses often experience severe and lasting psychological trauma requiring extensive treatment and support. Families of individuals with sexual sadism disorder may struggle with shame, guilt, fear, and confusion about their loved one's condition. Communities bear the burden of increased security measures, trauma recovery costs, and ongoing safety concerns. Looking toward the future, the field continues emphasizing comprehensive, evidence-based approaches that integrate multiple treatment modalities while maintaining primary focus on victim protection and risk reduction. Success requires sustained collaboration between mental health professionals, law enforcement, legal systems, and correctional institutions. The ultimate goal remains preventing harm to potential victims while providing appropriate treatment for individuals struggling with this serious condition, recognizing that public safety must remain the paramount consideration in all treatment decisions and interventions.